Hello, Auricular Braves. I hope you're all braving today okay. I will be sending you homework for your Auricular class for week 6, but I wanted to come on and at least say hello to you, and I'll probably send you another video answering questions before the term is done. So class tomorrow would be our second to last class, and the class a week from Friday would have been our final exam. So we will have some homework during that last week. That will be the week 6 homework. That will be in lieu of a final exam. Some people had asked me about the EIP homework because originally when we had this class, there was an EIP project. So you will have a choice. You can either do the EIP project or I'll give you an alternative homework. You do not have to do both. But some people may have started on the EIP homework already or maybe particularly interested in EIP, so I want to give you the opportunity to do that. And then I'll tell you about the alternative homework as well. Welcome to my living room. See, we have an elephant in the living room, so you always get reminded, don't forget about the elephant in the living room. We have a zebra in the living room. The zebra reminds us of the medical adage, when you hear hoofbeats, don't look for zebras. I hope you've all heard that adage by now. If you haven't, we can talk about that in our next video. But it's also to remind us, when you hear hoofbeats, don't look for zebras, but every once in a while, it is a zebra. So an oscillator is like a zebra, and you have to make note of that. All right, so let's talk a little bit about the homeworks. The alternative homework is going to be you can do 5-point prescriptions for 5 different cases. These cases can be made up. You don't have to give me a lot of information about them. Use conditions that are of interest to you or conditions that you have or your family members have. And I just want, for each prescription, you want to say, what's the condition? And you're going to give 5 auricular points, because generally we use not more than 6 points on each year. So 5 auricular points. If you want to use 6, that's okay. And an explanation of why you're using each point. Does not have to be a long explanation. So I'll give you an example. If we were treating a COVID-19 patient who's at the lung heat stage, so you'd have to tell me they're at the lung heat stage, because we treat them quite differently depending upon the stage of the illness. So we have a patient with lung heat stage of the COVID virus. We're going to look first for the local points. So a local point for that might be, for instance, lung, because they're having lung heat, right? So we don't have to give any more explanation about that. We know the lung is the local point for a lung condition. So the local point would be the lung. Then you're going to look for master points. So the master thing we want to do in this situation is we want to look at what's the main thing we want to do. The main thing we want to do is clear heat and toxins in this situation. So we're going to look for points that clear heat and toxins. So in this case, I might choose to bleed Urjan. And that's probably what we would decide to do to clear heat. And maybe we would also use the liver point to clear toxins. So those are our master points. And then we're going to look for supporting points. The supporting points are going to differ depending upon your differential diagnosis. But in this case, we're going to say the supporting points might be the diaphragm point to descend the rebellious chi. So the person is still coughing. We want to descend the rebellious chi. We may use the spleen point. Why would we use the spleen point as a supporting point? Because as the lung is being taxed, the lung is getting weaker. So we want to support the lung, and we support the lung by supporting the mother, right? So the mother of the lung, the spleen is going to support the lung, right? In the 5-element cycle. So that's why we'd use the spleen. And we might also use Sanjiao, just use the Sanjiao to help things continue to circulate, because one of the things that happens in the lung heat stage with COVID, as I'm sure you've heard, is that the phlegm dries up and things aren't circulating effectively. Also not circulating effectively because the lung is not circulating qi. So that would be our 5-point prescription example in our alternative. I'm going to share my screen if you want to do the EIP project instead. I'm looking to see if I can find EIP project here. Okay, so here is the EIP project. Ignore this is on our syllabus. And so if you see on the syllabus, there's things that say first draft. In this case, we're not going to do a first draft. We're just going to do a full draft. So you do the description of the complaint. So it's like a case study that you're doing, but do not do too much work on describing the complaint or the patient. We just need enough information so that you would know which points to use, right? So in most cases, it doesn't matter how old the person is, unless they're particularly elderly or they're a child. We don't really need to know much, but if, for instance, your case study is migraine headaches, we might want to know where does what kind of symptoms does the person experience, because that's going to determine which points we're going to use. Or if they have headaches and they have tension headaches, we want to know where do they feel where on the head, because that's going to help you, again, determine the points you want to use. So you want to describe the complaint. You want to pick 5 points that you're going to use, just like you were going to on the other assignment. You're going to find a study that supports the use of at least one of these points. Okay, so you can find a study and you can cite it. If you cannot find a study on the condition you're interested in, let's say you're going to treat somebody with dysmenorrhea and you can't find an ear acupuncture study for dysmenorrhea, you can use a general study for dysmenorrhea and transfer that knowledge to ear acupuncture. So let's say a dysmenorrhea study is using, I don't know, liver 3. You might decide based on that, you're going to use the liver point on the ear. So you can do that if you want to. It doesn't have to be the exact same condition. It doesn't have to be ear acupuncture. So if you find, let's say you find a study on headaches. Okay, dysmenorrhea and headaches quite different, but they're both treating pain, so you might have some of the same pain points. So you can use your imagination, but do with each point, you want to do the evidence-informed practice. So you want to say, why are you using each point, or where did you get that information? If it's obvious information, like you're using the uterus for dysmenorrhea, you don't have to explain why you're using that. But if it's something that we might not obviously see the connection, then see where you're using the connection. I'm not looking for anything longer than a page or 2 at most. And the last piece of it is, how would you use this in your practice? Okay, and you want to use APA format with the references at the end in APA format. So that's if you decide to use the EIP assignment instead of using the alternative assignment. So the other thing I'm going to do is answer some of your questions, and I'll come back on another time to answer more questions. But let me take a look and see if I can find your questions on my computer here. And if I can find some of your questions, I'm going to go ahead and answer some of those questions that people have been asking. I won't answer all of them today. Okay. So questions. Okay, so these are some questions that we haven't answered so far. And I think I'm going to share the screen on those actually too. So hold on, I'll see if I can share the screen once I find you guys again. Okay, let's see if we can find our questions. Is that our questions? Okay, so these are our questions. Do we needle the back of the ear? Yes, we do needle the back of the ear. Personally, I don't use it too much because logistically, it's kind of a pain in the ear. So if you're putting points in the front of the ear and the back of the ear, as you can imagine, it's hard to, once you put points in the back of the ear, it's hard to put points in the front of the ear. Once you put points in the front of the ear, it's hard to put points in the back of the ear. But occasionally we do use the back of the ear. It's used quite a bit for neuromuscular disorders, among other things. The main things I personally use it for are the vagus nerve point and the reverse Shenmen. The vagus nerve point is used when there's a really intense sympathetic response, particularly in the digestive system, when it feels like everything's just sort of gone awry. That's a really good point to use. That's a point that we should practice needling once we get back into the college. So nobody's going to be required to come back and do lab after this semester. We are going to give you credit for it. However, I really encourage you when we do labs to come back just to practice some auricular acupuncture in person, and particularly to practice points like the vagus nerve in the back of the ear, so you can see how to do it correctly. The other point we use a lot on the back of the ear is the reverse Shenmen, which is great for stress, also for ADD, ADHD. So it's particularly good for the times when stress causes ADHD type behaviors, and that's times just like now. Right now, a lot of people are having difficulty concentrating. They're kind of starting one thing and then starting something else and forgetting where did they put the keys and all that kind of thing. And stress can cause that, and that's something that the reverse Shenmen point is quite good for, and we'll talk a little bit about how to locate that in a minute. Okay, also the lower blood pressure groove in the back of the ear. Sometimes it's you get more blood when you do it there than on the arjan, on the apex of the ear. So that's the blood pressure groove in the back of the ear also is used quite often. Next question. This is about the nerves in the ear from week 2, the picture of the nerves in the ear. Is this a biomedicine correlation or one based in clinical experience from acupuncturists over time? And the answer is not really either. So this picture here of the ear nerves, these are the actual nerves that biomedicine recognizes go to the ear. Okay, so these nerves actually go to the ear. But in the figure that you had, which was from the Strittamata book, that lists every cranial nerve and which cranial nerve is located where on the ear, that's not from biomedicine. What the French and the Germans did is they actually checked electrical conductivity and electrical resistance in the ear. So they would stimulate the nerves, the particular nerves. So let's say they're stimulating a particular cranial nerve, and then they would check through the ear to see where there was decreased electrical resistance and increased electrical conductivity, and that's the point. And then they would test that over time with people who had a problem with that nerve. Is that where the person was tender, and did needling that point help the person's nerve problem? So that's how that experience was developed over time. And in fact, that's where the testing, how the testing was done for almost all of the French auricular and German auricular points. And the Chinese points were retested that way as well. So that's how we determine where the acupuncture points are. The original Chinese acupuncture points, obviously they probably didn't test that way originally, but they have now been tested that way. Okay, let's see what other questions. Oh, so we're talking about the location of the reverse Shenmen point. People were asking about that. That point's not exactly located on the back of the Shenmen. It's called the reverse Shenmen point because people at NADA only learned 5 points, right? When we were doing NADA, all we had were the Shenmen, sympathetic Shenmen, kidney, liver, and lung. So they found this point was really effective on the back of the ear, and it was near the reverse of Shenmen, and that was the only point people knew, so they call it reverse Shenmen. It's really closer to the heart point on the back of the ear. It's where the triangular fossa comes to a point. There's usually a little hollow there, or there's often some veins on it. So I just wanted to show you a couple of ears how to find it. So you can see here on this person's ear, you see there's a little triangular fossa there. At the bottom of the fossa, you can see there's a little hollow here that I put a green dot on. And here's another person's ear. You can see this is his triangular fossa, and he has a little green dot there as well. Okay, week 3 questions. What does the wonderful point on the concha wall do? Are there any combination of points that include this point that are used for pain management, even though it's associated with the thyroid? The wonderful point, also known as the marvelous point in the middle cervical plexus, has a similar function to the sympathetic point. It's not really quite as strong. It's a European point, so you won't be responsible for it in exams. It relaxes the fight or flight response, reduces hypertension, and regulates vessel dilation to relieve muscle tension. So it works like sympathetic. It's not quite as fast or as strong. Is this tranquilizer point a point that can be used for those in the birthing process? So again, tranquilizer point isn't one that you're often tested on, but good to know. You could use the tranquilizer point in the birthing process, but there's many other points you might choose instead of that, based on the client's pattern and symptoms. For instance, if the mom is anxious and feeling out of control and feeling kind of disconnected, that happens very commonly with mothers whose normal coping mechanism is to be in control, right? And to be in control and be controlling. So in that case, you might use Shenmen. Shenmen's often on the menu with people who are induced. So if somebody has labor induced, talk about, so the contractions come on very suddenly, and that makes people feel very much out of control. So the liver point can be useful to them. Liver also is helpful to smooth out the birth process. The kidney point, the uterus point, points for pain in general. So there's lots of different points for pain on the ear that you've now learned. If you're particularly interested in acupuncture for birthing, ear acupuncture and ear seeds are one of the go-to things for acupuncture during birthing, one of the best choices, because it's not uncomfortable if the patient needs to change position. If you've been through a birth with somebody, they're usually thrashing around quite a bit. Having, you know, needles in their legs or in their arms doesn't usually work very well. You're usually looking at the scalp or the ears. So ear acupuncture is very useful for people who are laboring. Why are there 3 pokes per point on the helix of the ear when you're bleeding the ear? I know numerology is very important in Chinese medicine. Yes, 3 is considered a balanced number, and that is that's part of why we use the 3. Also, you get more blood out if you make 3 pokes. So that's the answer to that. What does the shaking and the pulling of the ear during auricular bleeding accomplish? Are there more methods we should know about? So the shaking and the pulling of the ear, for anybody who watched the ear bleeding video, the shaking and the pulling of the ear increases the blood circulation in the ear. And that means that there's going to be more blood emitted when you prick it. Also, so other techniques, applying alcohol on a soaked cotton, that increases bleeding. So those of you who ever tried to stop bleeding with an alcohol soaked cotton, it actually has the reverse effect. So you never want to use an alcohol swab or an alcohol soaked cotton to stop bleeding. The alcohol actually increases the bleeding. So that's the end of our question and answer session for this week. I will come on and answer the rest of the questions. You'll all get to find out what the conditions were that you guessed. The homework, so I know many of you have turned it in already, but it's not due until tomorrow or Saturday. After that, we'll let you know what the conditions were that you guessed on, and we'll be back to learn more auricular. I hope you guys are using some of your auricular, at least with seeds, to be able to get through this very difficult time we're having here in New York. I know Acupuncturists Without Borders, we're setting up a system to educate healthcare providers with some Chinese medicine things that they can do, and we're relying very heavily on ear seeds, as well as other techniques for things that they can use for self-care and to also help their patients. So I hope you are using what you're learning. I hope you're doing okay. If there's anything you need to ask or reach out about, please don't hesitate to contact me, and I'll see you soon. Take care.